Are you one of the 21 million Americans suffering with life-altering low back pain? In the next few minutes, you will learn about a revolutionary breakthrough in the science of relieving back pain and restoring the quality of life that comes from living pain-free. Back pain is epidemic in America, with an astounding occurrence seen in 8 out of 10 people by age 40. Second only to the common cold, it is the most expensive non-life-threatening ailment seen in doctors' offices across the U.S. and around the world. Current treatments include drugs, surgeries, manipulation physical therapy, and acupuncture. For patients non-responsive to any form of treatment, pain management clinics have become popular to control chronic pain with narcotics. But why hasn't a non-operative procedure been developed as a standard of care for low back pain sufferers? One has, and it is called Lordex. For the next few minutes, we will discuss what causes back pain and tell you about an exciting new procedure that may potentially end your pain and suffering for good. All back pain can be divided into 2 categories: medical and mechanical. Medical includes recent fractures, tumors, infections, or metabolic diseases. Women who are pregnant or in advanced stages of osteoporosis may be included in this group. They represent 3% of all low back pain sufferers. However, 97% of people with acute or chronic back pain have what physicians refer to as mechanical spinal pathology. This means the pain is a byproduct of spinal instability and may result in a disc herniation, degenerative joint disease, sciatica, facet syndrome, and even spinal stenosis. Mechanical back pain may develop from inherited, congenital, or acquired components. Inherited, we get from our parents. Congenital, we get from birth, such as a short leg or structural anomaly. And acquired from either impact trauma or repetitive stress. Ultimately, as we age, the muscles, tendons, and ligaments undergo wear and tear, weaken, and therefore no longer support the normal lordosis of the lumbar spine. Man walks in the upright position, unlike 4-legged horizontal animals, and only has 2 legs for support. Therefore, the lordotic curve functions to distribute the vertical weight so that no one vertebra carries all of the weight. Over the years, the inherited, congenital, or acquired changes may allow for a loss of lordosis, producing dysfunction. The dysfunctional spine exists without pain until such a time that a critical mass is reached and the dysfunction exceeds the pain threshold. This is where most people go see their doctor. Medication is prescribed to reduce pain, but does nothing to address the underlying problem of mechanical instability. As the lordosis is lost, the joints move abnormally. The erratic motion in the disc causes a loss of fluid and a decrease in disc height. If the disc forms small fissures, the disc may migrate outward toward the nerve root. Pressure on sensitive nerve fibers from the disc, nerve root, or facet joint may cause a cascade of nerve messages to the brain, putting the muscles into spasm. This cycle is often repeated over days, weeks, months, and eventually for years, until the degenerative changes become visible on X-ray and MRI. Physical therapists, chiropractors, and medical physicians perform a variety of techniques that are done in earnest to reduce pain. If the condition becomes too extreme and the pain intolerable, the back pain sufferer may attempt surgery as a final attempt for a cure. Unfortunately, almost half of all spine surgeries have less than satisfactory outcomes. The procedures developed by the Lordex Corporation in Houston, Texas, were created to become the standard of care for both acute and chronic low back pain sufferers with herniated disc, degenerative joint disease, sciatica, and facet syndromes. Based on the principles researched at major universities and in clinical settings, the Lordex focus was on reestablishing functional capacity and decompressing the sensitive nerve fibers non-operatively, that is, without surgery. A spine surgeon does one of 2 things: decompression laminectomy or fusion to stabilize. These procedures require cutting of the tissue, destruction of support tissue, and the risk of anesthesia, not to mention the high cost of a procedure that has only a 50-50 chance of long-term relief. Lordex approaches the problem exactly the same way, but from a standpoint of a non-operative closed procedure. Surgery is open reduction decompression. Lordex is closed reduction decompression. Surgery is open fusion for stabilization. Lordex is closed stabilization through increased paraspinal muscle strengthening. The proprietary equipment developed by Lordex took 15 years of research to become what is now known in doctors' offices across the country as the Lordex lumbar spine system. The system is comprised of the LDU, Lordex decompression unit, the RX1 Lordex strength restoration therapy machine, and the therapist-assisted Lordex Stretch Flex program. The loss of lumbar spine strength leads to the ultimate decline in stability. An unstable spine can generate pain from the normal activities of daily living. Coughing, sneezing, lifting, and bending may aggravate the back. You now have a complete cycle. The RX1 targets the lumbar muscles to reintroduce kinetic activity sufficient enough to produce an overload stimuli to cause muscular hypertrophy and restore functional capacity. Simultaneous application of the LDU, Lordex decompression unit, comfortably tractions the spinal joint, distracts the compressed lesions, and eventually reduces the pressure inside the disc, thereby reducing pain. Unlike conventional traction that stretches the back only, the Lordex decompression procedure aids in reconstitution and disc healing, allowing increased blood and nutrient supply to the damaged area. The Lordex lumbar spine system is the most sophisticated technology in the field of non-operative spine medicine today. Following each procedure, patients generally undergo a stretch and flex program designed to improve lower extremity flexibility and range of motion. It has been clinically observed that the best long-term results occur when individuals take an active part in prevention. Once a patient concludes the 20 to 30 hours of the Lordex spine procedures over a 4 to 6 week period, they are usually prescribed a spinal hygiene machine for continuous home care treatment. A video explanation of use accompanies the spinal hygiene machine. Remember that most people live above and below the pain threshold without ever returning to normal. The goal at Lordex is to restore functional capacity and decompress the nerves to return you to an active, productive life.
Hello, I'm Jay Dodds, and I'm 42 years old and been suffering from back pain for the last 10 years. I was injured in a basketball game and had lower back surgery and never really recovered fully from it. And I've been going to different people throughout the last 10 years, and the Lordex Spine Institute was recommended to me. And I came here feeling really good about this business being able to help me. And after a number of treatments, I really began to feel much better. And I'm getting back to some of the things that I haven't done for 10 years, like riding a bicycle and looking forward to getting up and going hunting and fishing without having to be nagged by lower back pain.
My name's Scott Rubenstein. I actually have been very physically active my whole life. I was an avid surfer for a number of years. I've done everything possible to torture my body in every way possible, but did not really experience any type of back pain in my life up until probably 2 years ago. I went to join a basketball league, went for one practice session, went for a layup, and was in bed for a week after that with a lower back pain. Ended up going to the doctor, getting an MRI and getting diagnosed with a slightly herniated disc in the L5 region of my lower back. And I come over here and they show me the Lordex unit. After about a week, and you start doing it every other day, 3 days a week, and really started to benefit from it. The pain started going away. I could put on my shoes in the morning with that, and bend over without having to sit down and reach in pain for my foot to put my shoe on. Got back out on the golf course without a problem, and I've now probably been through 20 treatments, and I honestly feel like I'm cured. I'm going on a surf trip next month and going skiing this year and not worried about my back at all. I've joined an indoor soccer league. I play soccer now, which is something I could have never done a year ago, and so it's been wonderful. It's been great.
If a person has problems in his back, before thinking about surgery, I think he should be thinking about non-operative care, and the Lordex concept of using traction as a means of decompression And the exercise program, which is a means of muscle buildup and stabilization, is something that really should be looked into and thought about by most people.
My name is Stan Jones. I'm an orthopedic surgeon who practices exclusively spine surgery and specific treatments to the low back for the restoration of people's ability to get back to their normal activities and do so without pain. I recently became acquainted with the Lordex system because I was interested in trying to find every way possible to alleviate people's pain from the extent that people could restore their function to the low back and achieve their normal daily activities in a very happy and meaningful way without being totally disabled and being a couch potato. The Lordex system restores function by the unique system of distracting each disc space and in so doing isolating each vertebral segment. That then is in combination with restoration of spinal function, and restoration of spinal function has to be achieved with strengthening of the lumbar spine. The muscles of the lumbar spine are the most difficult muscles to isolate in the body. The Lordex system allows us to be able to strengthen muscles that have been decimated to chronic atrophy due to disuse, and that's why the Lordex system once again works so beautifully.
While some patients' conditions exceed the limitations of any procedure, the 86% success rate of the Lordex procedure makes it promising for most people suffering from acute or chronic pain in the low back. If you are tired of living with low back pain, you owe it to yourself to find out if you're a candidate for this exciting new procedure. Call the Lordex Spine Center in your area to schedule an appointment today. Lordex has saved thousands of patients from low back pain without surgery. Lordex, where the future of your back pain changes for good.